If you're over 60 and dealing with sciatica, stop stretching. Seriously, if you've been pulling your knee to your chest, doing hamstring stretches, or trying to stretch out that leg pain, you might actually be making it worse. And no one tells seniors this. Sciatic nerve pain is not usually a flexibility problem, it's a stability problem. And today, I'm going to show you the only 3 exercises you need to calm the nerve, reduce pressure, and actually start healing safely at home. No aggressive stretching, no twisting, no complicated gym routines, just 3 targeted movements designed specifically for adults over 60. And number 3 is the one almost everyone skips, but it may be the most important. Let's start with what sciatica really is, because understanding this changes everything. Sciatica is not a muscle problem, it's nerve irritation. The sciatic nerve is the largest nerve in your body. It runs from your lower back, through your hips, down your leg, and sometimes all the way to your foot. When it gets compressed or irritated, you may feel sharp shooting pain, burning down the leg, tingling or numbness, weakness when walking, pain that worsens when standing too long. Now here's what most people do. They try to stretch the pain away. But imagine this, if you step on a garden hose and water flow is blocked, does pulling harder on the hose fix it? No, you remove the pressure. That's what we're going to do. After 60, the most common causes of sciatic irritation are disc changes, spinal narrowing, weak hip muscles, poor posture, prolonged sitting. Notice what's not on that list. Tight hamstrings. Overstretching can actually tug on an already irritated nerve. So instead of stretching the nerve, we calm it, we support it. We stabilize around it. Let's begin with exercise number 1. The supported pelvic tilt, nerve decompression reset. This first movement may not look impressive. In fact, it's so small that many people underestimate it. But for adults over 60 dealing with sciatic nerve pain, this can be a game changer. Why? Because it gently reduces pressure in the lower spine. Without forcing anything, it's subtle, it's controlled, and it's extremely safe for seniors when done correctly. Now let's set it up properly. Lie on your back on a firm surface. A carpeted floor or a supportive bed works well. Bend your knees so your feet are flat on the floor, about hip width apart. If your neck feels strained, place a small pillow or folded towel under your head. Your arms can rest comfortably at your sides. Take a slow breath in. Now, as you gently breathe out, slowly tighten your stomach muscles, just enough to flatten your lower back into the floor. Don't push hard, don't force it. Think of it like you're lightly tucking your tailbone under you. Another way to imagine it, picture trying to press a small grape under your lower back, gently, not aggressively. You should feel your abdominal muscles engage slightly. Your hips do not lift. Your feet stay grounded. Your shoulders stay relaxed. Hold that position for 5 slow seconds, then fully relax and let your lower back return to its natural curve. That's 1 repetition. We repeat this 10 times, slow and steady. If you feel your thighs or hips gripping too much, ease off. This is not about strength, it's about alignment. Now let's talk about why this works. As we age, many people develop an exaggerated arch in the lower back. This can happen from years of sitting, weakened core muscles, or posture changes. That increased arch narrows the spaces where spinal nerves exit, and when those spaces narrow, the sciatic nerve can become irritated. This gentle pelvic tilt temporarily widens those spaces by restoring a more neutral spine position. Think of it as creating a little breathing room for the nerve. You're not stretching it, you're not compressing it, you're simply resetting alignment. And that small change can reduce irritation significantly over time. Here's something important. If your leg pain increases sharply while doing this, stop. But if the pain stays the same or slightly improves, That's a positive sign. Mild muscular effort is normal. Sharp nerve pain is not. Perform this exercise twice per day, once in the morning to reset your spine after sleeping, and once in the evening to unload pressure built up throughout the day. Consistency matters more than intensity. Many seniors notice subtle improvement in 1 to 2 weeks when done regularly. Now remember, reducing pressure is step one, but decompression alone isn't enough. If we don't strengthen the muscles that support your spine, the pressure will return. So now that we've created space, we need to stabilize it. Let's move to the next exercise. Exercise number 2, the glute bridge hold, hip stability builder. Now we move to something most people completely overlook when treating sciatica after 60. Your glutes. Weak glute muscles are one of the biggest hidden causes of ongoing sciatic nerve pain in older adults. Here's why that matters. Your glutes are the largest, strongest muscles in your body. They're designed to power walking, climbing stairs, standing up, and keeping your pelvis stable. But after 60, especially if you've spent years sitting more than moving, those muscles often become weak and underactive. And when your glutes don't do their job, your lower back steps in to compensate. That extra strain increases compression in the lumbar spine, and over time that can irritate the sciatic nerve. So instead of stretching the leg again, we strengthen the support system. Here's how to do it safely. Stay on your back from the previous exercise. Knees bent, feet flat on the floor, hip width apart, hip width. Before you lift anything, gently tighten your stomach muscles just a little, the same way you did in the pelvic tilt. Now squeeze your buttocks together. You should feel the muscles in your hips activate. From there, slowly lift your hips a few inches off the ground. Not high. You are not trying to form a big arch. Just lift enough so your hips come slightly off the surface. Think small and controlled. Hold for 5 slow seconds, then lower your hips back down gently, not dropping, not collapsing. Repeat this 8 to 10 times. Quality matters more than quantity. If lifting feels too difficult, or if it increases back discomfort, modify it. Simply lie there and squeeze your glutes for 5 seconds without lifting. That alone begins to retrain those muscles to activate properly. And for many seniors, that's enough to start reducing strain on the spine. Now here's what this exercise actually does. It supports the lower spine. It stabilizes the pelvis. It reduces excessive movement that irritates the nerve. It improves walking balance and confidence. And it decreases pain during standing. But here's the most important part. Go slow. No bouncing. No thrusting upward. No arching your lower back. If your ribs flare upward or your back feels compressed, you're lifting too high. You should feel this primarily in your hips and buttocks, not your lower back. If you feel cramping in your hamstrings, bring your feet slightly closer to your body. Small adjustments make a big difference, and here's something encouraging. Many seniors report noticeable improvement in leg pain within 1 to 2 weeks simply from improving hip stability. Because when the hips are strong, the spine doesn't have to overwork. And when the spine isn't overworking, the nerve calms down. Now we've reduced pressure, we've added stability. But there's one more piece. And this final exercise directly addresses the nerve itself, gently, safely, and effectively. Let's move to the third and most overlooked movement. Exercise number 3, the seated sciatic nerve glide, the one most skip. Now we arrive at the exercise that many people have never heard of, but it may be the most important movement in this entire routine. This is called a nerve glide, and I want to be very clear about something first. This is not stretching. We are not trying to pull the nerve longer. We are not forcing flexibility, because when a nerve is irritated, inflamed, or compressed, aggressive stretching can sometimes make symptoms worse. Instead, what we want to do is help the nerve move smoothly through the surrounding tissue. Think of the sciatic nerve like a long electrical cable inside a protective tunnel. Normally, that cable should slide slightly as you move, but when inflammation or pressure builds up, the cable can become stiff and restricted. So instead of pulling on the cable, we help it glide gently. That's what this exercise does. Let's set it up. Sit tall in a sturdy chair. Your back should be straight but relaxed. Shoulders loose, feet flat on the floor. Now slowly straighten one leg in front of you. Do this gently. Do not lock the knee forcefully. As you straighten your leg, simultaneously flex your foot toward you, as if you are trying to point your toes upward toward your head. You should feel a mild pulling sensation along the back of your leg. That feeling is normal, but it should never be sharp, burning, or shocking. Now here is the key coordination step, and this is very important. As you flex your foot toward you, gently lift your gaze upward toward the ceiling. Then slowly lower your leg back down. And at the same time, slightly lower your gaze or look forward. This coordination between leg movement and head movement helps create a gentle sliding motion along the nerve pathway. We are not forcing tension, we are encouraging mobility. Think of it like gently oiling a stiff hinge so it can move freely again. Repeat this movement 10 times slowly on one leg. Then switch to the other leg. Move at a comfortable, controlled pace. If you feel sharp pain, electric shock sensations, or worsening numbness. Reduce how far you straighten the leg. Everyone's range will be slightly different. Your goal is not maximum movement. Your goal is comfortable nerve motion. The sensation you're looking for is mild tension or gentle stretching, not zinging pain down the leg. If you feel pain, back off slightly. That is your body telling you to stay within a safer range. Over time, as the nerve calms down, your comfortable range may slowly improve. This movement helps restore the nerve's ability to slide smoothly again. Imagine it like helping a stiff old door hinge move without resistance. And this is often the missing piece in many senior sciatica programs, because many programs focus only on stretching muscles. But nerves are not muscles. Nerves respond better to gentle mobility and pressure reduction. So remember this simple principle: not stretching, not twisting, gliding. Slow movement is healing movement. Do this exercise once or twice every day. Many people find it helpful to do it in the morning and again in the evening. And when combined with the pelvic tilt and glute stability exercise we talked about earlier, you are addressing sciatica pain from 3 important angles: pressure reduction, muscle support, and nerve mobility. That combination is what makes this routine so powerful for adults over 60. Now let me share one more important thing before you go, because this part could keep you safe. Why stretching can make it worse. Many traditional programs recommend toe touches, deep hamstring stretches, figure 4 stretches. But when a nerve is inflamed, aggressive stretching can increase irritation, especially if pain shoots below the knee, you feel tingling or numbness, pain worsens after stretching. In those cases, stability, flexibility. After 60, strength and alignment protect the nerve far more than flexibility. When to see a doctor? Now let's be responsible here. See your doctor immediately if you experience loss of bowel or bladder control, severe weakness in one leg, sudden worsening pain, pain after a fall. Sciatica improves with conservative care in most cases, but serious symptoms require medical attention. Putting it all together in a simple routine, here's your routine. Morning, pelvic tilts, 10 reps, nerve glides, 10 each leg. Evening, pelvic tilts, 10 reps, glute bridges, 8 to 10 reps, nerve glides, 10 each leg. Total time, less than 10 minutes. Consistency matters more than intensity. If you've been stretching for months with no relief, maybe your body has been asking for something different. You don't need 12 exercises. You don't need painful stretches. You need the right movements. And these 3, done consistently, can change everything. If this helped you, comment relief below so I know to create more senior-focused pain videos. And remember, pain after 60 isn't inevitable. It's often mechanical. And mechanical problems can improve. You deserve to walk comfortably. You deserve to sleep without leg pain. And you deserve a plan that works.